Thanks for staying with us. So, we're going to be having Dr. Stella Alagbe joining us to help us discuss this issue of medical malpractice. Good morning, madam. Are you there?
Good morning. Yes, I'm here.
Good to have you. So, before you came on, we're discussing medical malpractice in Nigeria, how prevalent it is, and the fact that many people have been complaining of misdiagnosis in the hospitals. In your experience, madam, what do you think is the cause of this, and how can we begin to reduce the amount of this kind of misdiagnosis?
Okay, well, misdiagnosis is not something new, in the medical world. However, I think one of the important things that will help curb that is knowing when to refer and who to refer to. Okay? That's why there are specialists. The field of medicine is very vast, and we have all sorts of specialists catering for the different aspects of healthcare. So the key, in my opinion, to solving the problem, or at least reducing the problem of misdiagnosis and poor care in our healthcare service, is actually knowing when to refer and referring promptly. But also beyond that, I think part of the problem is the accessibility to healthcare of our people. A lot of our people don't have access to quality care. And one of the basic reasons for that is finance, because our hospitals are not generally, well-funded to cater for patients who can't pay out of pocket. And the health insurance system is still very poorly developed in Nigeria. So a lot of people have to pay out of pocket for their healthcare needs. And because of that, they resort to either quacks or self-help to take care of themselves when they are sick, rather than go to proper hospitals, do proper tests, and get proper diagnosis. So a lot of it is due to lack of access, but also when the patients do come to the hospitals, the first point of care should know how to assess the patient immediately, how to refer or who to refer to, with each presentation they receive.
Right.
Okay, ma'am, there's this, for me, I feel that there are different reasons why this could be. And sometimes I think it all has to do with the educational system. So we have people who go to medical schools. And one of the things we hear a lot about is that graduates just seem so half-baked, just don't seem as if, they've been through the university. Could that be a root cause, that the level of education that we have in Nigeria is just so poor that we're not bringing out well-qualified doctors?
I'm not sure I totally agree with that. I think that, despite the challenges we have in Nigeria, our medical education is still quite top. And if you look around the world, in most parts of the developed world, you find out that Nigerians are at the top of their game in the US, in the UK, in other parts of the world. Nigerians who are trained in Nigeria go out there and do excellently well. So it's not a problem of medical education. It's really a problem, I think it's more of a problem of access. Number one, even if we know what to do, a lot of the hospitals, either they lack the facilities, the lab facilities and other things they need to make appropriate diagnosis, or even if they can afford to do that, the patients can't pay for the test, because they have to pay out of pocket for that. So to me, I don't think it's primarily an issue of quality of training.
Right. Okay. Wait.
More of a lack of access.
All right. Let me take this call from Samuel Mashe. Good morning, sir. Good to have you on the show.
Good morning.
You're live. Go ahead, sir.
Yes, I was just trying to add my own
The volume is very low. I'm trying to hear you.
Okay.
Okay, that's
Can you hear me now?
Yes, I can. Thank you.
Okay, I'm just trying to add now 2 cents to what you guys have been discussing because it's of great consequence to our health.
Right.
I had an experience about 10 years ago. I went to a very well-known hospital, which I will not mention. And they tried to put me there for and they said I had ulcer. And they started medicating me. After that, what saved me was that I was going to travel the day after. And when I got to the US, I was just visiting a friend's mother who was an octogenarian doctor. He just asked me 1 or 2 questions about my condition because I'd been taking the drugs and I was feeling woozy and uncomfortable. And just asked me 1 or 2 questions, and I said that was negative. And they said you had ulcer. Say stop taking those drugs, and I stopped taking those drugs up to today, and I've been fine. So the problem is that if you are misdiagnosed, the medication that results from it will create another ailment. So people will start treating the illness that a misdiagnosis has created into the body. So it is really a complicated issue. Right. So you go to the hospital, you are misdiagnosed, and then the hospital gives you its own treatment and start treating it. Yeah. So I think this is one of the great consequences of this issue.
Thank you very much. Thank you very much, sir, for contributing to this conversation. Bisi was going to ask a question.
So, doctor, I know that sometimes a doctor diagnoses incorrectly because he's based his diagnosis on an inaccurate test result, either from the lab or radiology. What can be done to ensure that the quality of testing is improved upon, so that at least you can present something that is real to the doctors, because that's where they base their diagnosis from?
Dr. Lagwe, did you get that question?
Well, yeah, okay, I think I do. Well, again, that to me boils down again to a lot to funding. You know, some of the times, some of the facilities or the lab facilities that people go to have their tests done may not be well equipped. Maybe they may not have the appropriate, facilities to do the test. So they tend to cut corners to manage in order to save on costs. Because if you were to tell a patient to pay, okay, this test alone will cost you 5,000, for instance, and that is just a test, not to talk of the medication or the treatment you will take right after the diagnosis is made. The patient is more likely to, go to somewhere where he will find the test cheaper, or, if he sees a doctor that can, prescribe for him without appropriate tests, it's possible that he may opt to that. The gentleman that commented before, I didn't quite hear him well, but I think part of what I heard was that he was talking about being treated for ulcer when he didn't actually have ulcer.
Yes.
I don't know if I'm correct, but I think that's what I heard.
Yes.
So let me give you an instance. One of the main reasons, a lot of people say they have ulcer based on the fact that they have abdominal pain in some parts of their abdomen and all that, and they take treatment. Yes, that may be acceptable under some circumstances. But the actual diagnosis of ulcer can only be made after appropriate testing, and the gold standard is actually what we call endoscopy. Now, I'm sure the doctor would have thought, if I tell this patient to go and do an endoscopy before I can place him on medication to relieve his pain, he probably will think, I'm a wicked doctor. Do you know the average cost of endoscopy, even in government hospitals, is over 50,000? Wow. Okay? So that's just an instance. It's over 50,000 to make that diagnosis, not to treat it. So I can imagine that if a patient comes in severe abdominal pain and you have clinical evidence that this patient may have ulcer, yes, you will treat initially to alleviate those symptoms. And then you can subsequently tell the patient, go and do this test. But I guarantee you, a lot of patients will not want to spend that amount of money. In fact, 50,000 is a conservative. It goes up to 85,000
But I would rather, Dr. Alagwe, I would rather be told that I need to take that test and the cost than a doctor to give me medication for something that I may not have. So I would rather you tell me and I say, oh, it's expensive, I can't take it, please treat me. Then I know it's my own, it's on me. But I wouldn't want a doctor to be thinking on my behalf, or making that assumption on my behalf that, oh, if I tell him it's 50,000 naira, he will think I'm a bad doctor. Okay, but there's an angle like, yes, go ahead, madam. You wanted to respond to that?
Yeah, definitely. That's what I said. When the patient is in acute pain, the doctor will treat that patient to relieve the symptoms and subsequently let him know that he needs to get this test. But what I'm saying is that definitely doctor should tell him that you need to get this test done. And that is what we do.
All right,
and we ask them to come to the clinic for follow-up. But I guarantee you that most of the patients don't come back with that test because they feel relieved of their symptoms and they don't see why they should spend so much money, to do a test. That's from experience. But we do tell them that they need to do the test to confirm the diagnosis, and that's the right thing to do.
All right, let's go on a quick break. When we come back, we'll continue this conversation with you. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we still have Dr. Stella Alagwe with us. She's discussing issues surrounding medical malpractice. And later on we'll be discussing, because she's a nephrologist, we're talking about kidney a bit later. But I want to also wrap up on this issue of malpractice. YK, you had a question.
Yes, doctor. I was going to ask you, don't you think there should be a stricter regulatory board for hospitals so that they will stop misdiagnosing and they will make sure they have the right tools? Because there are so many mushroom hospitals all over Lagos, probably Nigeria. I can only talk for Lagos.
Dr. Alagwe, are you there? Hello, madam, are you there?
Okay, yeah. The question is for me?
Yeah, did you hear her? Yes, she was.
I am here, yes.
Yes. Did you hear YK? She was talking about.
Okay, you're talking.
Regulatory.
Stricter regulatory body.
Yeah, you said there's a need for stricter regulatory boards.
Yes.
I very well agree with you. I mean, every professional body, particularly medical, medical practice, requires good regulation, because we deal with life, and life is precious. And we do have, I guarantee you, we do have appropriate regulatory bodies, especially in Lagos State. I may not know much about other parts of the country, but I know that Lagos State is, very good. It has excellent regulatory, monitoring bodies. They actually monitor and then, do implement a lot of decisions that are made.
Okay.
So,
all right. Let me throw in one more question for you. Go ahead.
Okay, doctor. I know that misdiagnosis is apparently a mistake, because I don't think a doctor will, want to misdiagnose someone. And but there's something I understand about things like this when it happens. Nobody wants to take responsibility. Can we have a system whereby you make a mistake and the patient complains, this is what has happened, and you own up to your responsibility and apologize for that mistake? Is that something that can work for both the doctors and the patient to give us more confidence that, okay, they are human beings too and it can happen?
Well, like you said, we are all human beings and errors do happen. Anywhere there are human beings, errors do happen. But having said that, I don't think in medical practice the norm is to cover up or to deny. I think, from experience, most doctors are very concerned about their patients, and a lot of doctors go out of their way. We don't just, as doctors, we don't just, work casually like perhaps those who don't work with human beings, who work with files, carry files, and no. we realize that we deal with human beings. And as a matter of fact, because we relate with human beings personally, we feel their pain a lot of times. I can assure you that we do. I mean, I know a lot of doctors, under me or other places that go out of their way to support their patients. So we don't actually try to cover up or anything. It's just the human error that and the limitations we have in terms of access to diagnostic facilities and all that. So sometimes it's possible to get it wrong, yes. And we do admit that.
All right, let me get in one question.
I can't remember a case.
I have a caller waiting, madam. Let me take, Hassan, are you still there?
Yes, I'm here.
Okay, go ahead, you're live.
Good morning, everybody.
Good morning.
Please, let us get it right. We have good and wonderful doctors all over the space.
Yeah.
That is very clear. The same way we have bad doctors. We should ponder over three things here. First one, we should ponder over ethics. Second one, we should ponder over empathy. Third, we should ponder over patriotism and commercial interests. We are seeing commercial interests creeping into medical lines where doctors are out to exploit the patients. And in every sphere, in all the professions, we see them. When you go to accounting, you go to banking, you go to this, you go to that, you see them. And those people at the helm of affairs in those areas know the bad guys in their midst. The most important thing here is for them to be up and doing and flush out those bad guys, giving those noble professions a bad name. And a situation where you see in Nigeria here, people brave their ways to become medical doctors. What do you expect them to do when they come to proper practice? This is what we see. Garbage in, garbage out. Good morning.
Thank you very much. Okay, we have to wrap up on this, but because I wanted to move into the issues of kidney. But Dr. Alagbe, let me put this to you. I mean, I have this thought in my head that maybe the fact and the reality is that we do not have the funds. I don't know if I should say we don't have the funds, but we see that our hospitals are not well funded. We see that many people, most Nigerians, would rather go to either the traditional herbal doctors or even so, I would call them quacks, doctors who are not really qualified to do this job because they can't afford to go to proper hospitals. My question therefore is, don't you think it is time for us to bring this hospital to the grassroots such that we empower those native herbs providers, empower them so that they are certified to treat patients because the masses are going to them. So why don't we see what they're doing, how they're doing it, and advise on how they can do it better so that they can address these issues of people who are not able to go to the hospitals, who are medically ready for them. Just putting that out there.
Well, okay. Whether you certify them or not, the traditional health practitioners are there and they are doing their own bit, whether rightly or wrongly. And a lot of the things that end up in the hospital and you may see as malpractice may really be a consequence of some of the bad practices that were started by those traditional rulers. I can tell you for this, traditional practice actually has a place in Lagos State. I know that they can be registered, there's a provision for them. They are supposed to be open with what they do and all that. But it's difficult, so they have their own system of doing things. They have their own way of doing things. I know that the government things, for instance, traditional bed attendants, there's been an attempt, by the primary healthcare service to partner with them in order to reduce, the incidence of maternal and child mortality and morbidity that comes as a consequence of some of the malpractices that start from there. Simple things. So yes, at that level, at the level of primary healthcare, there has been a lot of engagement of traditional health practitioners. Having said that, you and I know that it will be difficult for for us, for medical doctors, for instance, to train traditional health practitioners to adopt our own ways of doing things. It took us years to get this training, and they already have their own fixed way of doing things. So it will be really difficult for us to actually, get them, to do things the way we do. But basic things like how to prevent infection and things like that, yes, they can be done, and they are being taught actually. Especially, I know there's been a lot of success with things like traditional bed attendants at the level of the primary healthcare. So with that, and other things like bone setters, especially with regards to curbing infection and curbing a lot of long-term complications that may result from what they do. So it's one thing to involve them, but it's another thing for them to accept and actually practice what you do, because they never really went through the fundamental training.
So let's talk about kidney for a while, because that's one of the things that women have to go through. The issue of kidney in women. We're still celebrating International Women's Day since yesterday, and part of what we'll be doing this week is addressing issues that women are susceptible to. One of which is kidney disease. I know you're also a nephrologist, so you can help us shed some light on how we can reduce the occurrences of kidney disease amongst women, especially in Nigeria.
Interestingly, Thursday, that's 2 days from now, is World Kidney Day, and it's a day we actually use, to create awareness about kidney disease and how to prevent it, how to help people, suffering from this disease and all that. So it is quite apt that we're talking about this at this time. And of course, yesterday being International Women's Day, it's also important to talk about kidney health, especially as it relates to women. Kidney disease is an important disease. Not only it affects up to about 10% of the population worldwide, and in Nigeria as well, and kidney disease, especially chronic kidney disease, is a serious diagnosis that can have quite devastating, effects on the patients, their families, and the community at large. So it's something that it's really better prevented. But in the event that people end up with chronic kidney disease, what can we do to help? The theme of this year's World Kidney Day is actually, living well with kidney disease. So the idea is those who already have kidney disease, how can they live well? And the emphasis these days is on not just, treating the symptoms, controlling the patient's, disease, but also getting the patient involved, because it's a chronic disease. It's something you live with for the rest of your life. If you have end-stage renal disease, and the patient's involvement in the care is very, very important.
Okay, Dr. Lagwe, usually when we hear of kidney disease, what most of us think of is kidney failure, dialysis. But I've come to understand that there are various types of kidney disease, and some can be treatable. Could you please explain to us what the different types are, maybe just a couple, and then what the symptoms are, so that if you think you may be having it, what are the lifestyle changes you could incorporate to stop it from degenerating into something like kidney failure completely?
Okay, thank you. That's an excellent question. There are so many different types of kidney disease. But why we talk so much about chronic kidney disease is that it's the end pathway or the end disease. All other kidney diseases that were not completely treated or did not resolve even after treatment, if they progress, the end of it all will be chronic kidney disease. Having said that, chronic kidney disease can result from simple things like, infections that were not properly treated, like urinary tract infection or pyelonephritis or chronic pyelonephritis that was not properly treated and ended up at the end of the day with permanent damage to the kidney. to things like immunological diseases, where you have the immune response of the body fighting against itself, at the end of it, ending up with chronic kidney damage. And other things like what we call nephrotic syndrome too, which is also, mostly immunological. Things like hypertension, diabetes can also impact on the kidney and at the end of the day lead to chronic kidney disease. Like I said, simple things too, like infection, or, infection for any cause. Bacterial infection, severe bacterial infection can actually affect the kidney. But usually, such will cause what we call acute kidney injury. And most people with acute kidney injury, acute kidney failure, will actually recover. Even if they may require dialysis for some time, they will recover. But a small fraction of them will also progress to chronic kidney disease where they end up with dialysis. Things like
all right, let me.
Diabetes, I've talked about diabetes.
Yes. Let me pause you for a second. I have a caller. Good morning, sir. Are you there?
Okay.
Hi, good morning.
Stanley, go ahead. You're live.
Okay, my name is Stanley. I'm calling from Lagos. Actually, I just got discharged from the hospital as a result of kidney infection. I actually had acute kidney infection and it was caused by sepsis. I'm actually lucky to be alive. You may know me as Dr. Counselor on Instagram. Yeah, I've actually been in the hospital since December, and it was crazy, trust me.
Wow.
Yeah, it was very, very crazy. I survived by God's grace. I was all swollen, like, I was weighing 100 plus, been on dialysis and the rest. And I'm glad you are talking about it.
Congratulations.
Thank you. I didn't see it coming, I just knew I was having, O+. We always believe whatever we have is malaria. And when you see the hospital, they were suspecting COVID. My COVID came out negative, and and it was crazy. But I'm happy to be alive because I had a relation that died 3 days ago as a result of kidney infection.
Stanley, let me stay with you. Stanley, let me stay with you for a moment.
What were some of the symptoms that you saw?
Okay, now the symptom I saw wasn't really, mine was, in fact, Africa, we talk about attack and all, but I don't believe it is, because I was just having the whole, I was having malaria, feverish, I was feeling feverish, and, all of those malaria kind of symptoms. By the time I got into the hospital, I was admitted, I was isolated, and they were looking out for, for COVID. Yeah. So by the time I was referred to 68 Reference Hospital, Yaba, I then, that was when sepsis was discovered. And trust me, my 2 kidneys shut down.
Wow.
I was extremely lucky. I was on oxygen. And in relation to the first topic that was being treated, one of the challenges we're having is what in Igbo we call Ezonyagwalam, the king that knows it all. There are most doctors that believe they know it all. Meanwhile, there are specialists who can easily detect these things and take it. I was lucky I had specialists all around me. So at the right time, they were telling us this is what to do, this is when to go for dialysis, these are the things you need, this is when you get the original of what you need, this is this, this is that. And trust me, I'm back home. I've been in hospital in January, I'm back home, and I know I still need to get better, but one of the challenges people go through is they don't get specialists that would. I believe a doctor online can tell us that not all doctors can handle everything.
Exactly.
We shouldn't
I think she
do this
mentioned it earlier.
in Nigeria.
Thank you very much, Stanley. Yeah, go ahead. One more question for you, Stanley.
The dialysis, are you going to be on it permanently now until you can have the kidney operation?
No. As a matter of fact, the way I was so lucky that I didn't need a transplant.
Okay.
At some point, they did a scan. There were holes all over my intestine, and they wanted to prepare me for surgery to seal them up. But a confirmation much later showed that all the holes were gone. I don't know how God did that miracle, actually. Wow. After the third dialysis, my kidneys picked up. I started losing weight, fluid. I started losing all of those weights and all, and I'm back home. That's all I know. I know I need to be more careful. But
I'm so happy that you're doing better and you're
Congratulations.
doing well. But I just want to know, do you know why you had the kidney problem that you have? Was it a lifestyle issue, or what caused
No,
it?
it wasn't lifestyle. I don't smoke. You know, the normal belief, I don't smoke. I'm not a chronic. I do only occasionally with my red wine. But what the doctor told me is AKI, acute kidney infection caused by sepsis. Now, sepsis, as I was explaining, from what I read up online, is a viral infection, and when it hits the human organ, it could go for the heart, it could go for the liver, it could go for the kidney. Mine, it went for the kidneys. Wow. You know, but I'm glad I came out.
Thank you so much, Stanley, for sharing your story with us. Let me come back to our doctor. Dr. Alagbe, you heard Stanley's testimony. Obviously, in his situation, he had specialists around him that were able to guide him right. Many people are not that lucky. You know, they can treat you for malaria for 6 months before you finally find out, oh, you have sepsis, before you're then diagnosed with kidney failure. How, Madam, the doctor, are you still there?
I am with you.
So in that situation, how do we, at what point does a patient request for specialists? At what point do you begin to say, I think I need to see somebody who knows better? What do you see? How do you know it's time to see a specialist?
Yeah, like I mentioned before, the field of medicine is very vast, and the key to avoiding misdiagnosis or underdiagnosis, as the case may be, is actually knowing when to refer and who to refer to. And it's also, you know, for you to know when to refer and who to refer to, you have to know the basic, you know, medicine. You have to know the basic things, you know, the patient symptom profile. Do some basic tests. There are some basic simple tests that, you know, can be done and, you know, that can help you detect, you know, a kidney, you know, problem. One of the things, like the gentleman that spoke now, what he had was acute kidney injury, you know, which is usually reversible, like I said, in most cases, and it's due to an infection. It can be due to bacterial infection, viral infection. In this case, most likely bacterial infection. Even COVID, a viral infection, can give you an acute kidney injury. But having said that, so that's why it is important to do basic things. One of the basic tests you will do is a simple urine test that can tell you, and it can tell you a lot of things. Is there protein in the urine? You know, is there evidence of a urinary tract infection, which you can see from the urine test? And then a simple blood test, you know, a simple blood test to check the status of the kidney. Not expensive, just a basic creatinine test will tell you if the kidney is working well or if the function of the kidney is jeopardized. Having said that, it's also important to pay attention to simple clinical clues. Yeah. One of the first things you notice if a patient is going to have acute kidney shutdown is that the urine output reduces. And in some cases, the person may actually not make urine at all in a day. So if a patient was in the ward, for instance, and you are monitoring the urine, and suddenly notice that urine output is dropping, you need to keep an eye on that. Right. Okay? One of the other common symptoms you notice is swelling of the feet and around the face or around the eyes, especially when you wake up in the morning. If you notice that happening, it's a good time, you know, to visit your doctor or for some basic tests. Okay? And, you know, if that is left to progress, for patients, you know, with acute or chronic renal failure, they may start having recurrent vomiting, you know, feeling unwell, hiccups, and some of these symptoms, when you go to the average doctor, if proper history is not taken and basic tests are not done, they will probably attribute it to malaria, or even worse, typhoid.
Let me take our final.
Those are common symptoms.
Let me take our final caller. Omolara, are you still there?
Yeah, I'm still there.
You're live. Go ahead, please.
Good morning.
Morning.
Good morning. I think I have three things that causes wrong diagnosis of patients. Number one, if a lab result is wrongly done, it will mislead the doctor.
Yes.
Because I have a scenario where I took my junior brother to a private hospital, a very reputable one in Lagos. I don't want to mention it. All the lab tests that were done, negative. Both wider, MP, other chest X-ray, scan, negative. Yes, he was not feeling well. I now took him back to a government hospital. They did another lab test for him. They found out he was medically ill, typhoid enteritis positive, malaria parasite positive. So they started the treatment all over again. And then that former private hospital, we paid over 100,000 They did almost 15 types of laboratory investigation. I don't know whether their reagents were expired or not potent, or the lab scientists, they were not good enough. I don't know. That is one cause that can lead to.
Thank you very much, Mama.
Another one, when overstaff, if we have shortage of manpower in the medical field, the doctors, if there are no competent hands, if we have so many health officers, no consultant on ground, only medical officer, there will be room for misdiagnosing of patients. Then they need to take good care of these doctors very well. If they are not taking good care of very well, they won't do the needful. Thank you.
All right, thank you so much, Amolara.
Okay, Dr. Stella, I wanted to ask if someone with acute kidney problem can fully recover. But now we have a living example in the person of Stanley. Now my question is, you know, sometimes when we hear kidney, we hear this person probably is a drunk, this person probably has been smoking, this person has lived a very wrong lifestyle. But with the case that we just had in front of us, Stanley, who recovered, his lifestyle had not been, you know, in that, he's not lived a bad lifestyle to affect his kidney. So what comes to my head is that the sepsis is even more of a problem than the kidney issue. Now, how do we preserve ourselves or our kidney or our internal organs that they do not degenerate? How do we stay afloat if you can still have a good lifestyle and come down with kidney disease?
Okay, well, thank you very much. First of all, let me say that kidney disease is really not for drunks and, you know, wayward people or people with bad lifestyles in quotes. But there are a lot of lifestyle issues that can be constitute a risk factor for kidney disease, which if we pay attention to, it can go a long way to helping prevent kidney disease. One lifestyle-related risk factor is actually smoking. Smoking is a no-no. So if you want to avoid kidney disease and a lot of other chronic diseases, especially cardiovascular disease, avoid smoking, quit smoking. The major risk factors for kidney disease or chronic kidney disease in our environment is actually hypertension and diabetes. Hypertension is something that usually does not present with any symptoms until it is really advanced. Diabetes too, a lot of times you may not even know you have diabetes until you start developing complications. So it is important that whether you feel ill or not, you do yourself the benefit of doing annual checks. Do regular checks on yourself. Basic lab tests, like I said, are not even expensive to assess your kidney health, even if it is once a year. Then, like I said, for the acute kidney injury or acute kidney failure, the things that cause it are very common. Things like infection, which you can pick up anywhere. Anybody can have sepsis. You know, the urinary tract infection, which is also much more commoner in women. You know, viral infections, as we have COVID now, and other viral infections. So anything you do, prevent those. And even simple malaria, severe malaria can actually affect your kidneys. So when you are ill, don't just resort to self-medication. Go to the hospital, get appropriately tested.
My own is a personal question, madam. Doctor, my own is a personal question. Me, I urinate a lot. Right. Can I have kidney problem? That means my kidney is working fine. That's my question. Is my kidney working?
Okay. When you say urinate a lot, it has to be. Is it because you drink a lot of water deliberately? Because urinating a lot also might mean certain things. So if you think it's unusual, if it's out of pattern for you, then you might need to investigate that, because sometimes infection in the urinary tract can cause you to urinate frequently. And also men who have enlarged prostate may find themselves going to pee more frequently. So if you think it's
let me take this call from Unduka, who's waiting for a while, from Owerri. Unduka, are you still there?
I'm there live.
Thank you for holding on. I do apologize. Go ahead, please.
Yeah, live. I can keep waiting for another 1 year.
Oh,
my own is a very serious case.
Yes.
I was sick, and I was taken to the hospital. Unfortunately, the government Federal Medical Center were on strike. So I was taken to a private hospital that is run by a mission. Put two together and put three together, they diagnosed that my 2 kidneys have failed. And I was now due to be taken to India for kidney transplant. Luckily for me, I had 2 members of staff who work with me. It's good to be good to your workers. 2 staff came up and donated their kidney to be used to cure me. And we were making arrangements to travel to India. I had a house, I put it up for sale, and people knew I was desperate. They could only offer 9 million naira. I accepted to sell. Since I wasn't going to pay for the kidney, I was only going to pay for transportation of my 2 members of staff and myself to kidney, to have that kidney transplant. Somewhere along the line, I have a brother who is a lab technologist. He came around, looked at that result again, and said, "Brother, who said this result is enough?" Because they rushed me to a dialysis center, Platinum, in the Red Street over. The man came there and said, who brought me to this place? This result doesn't really show that my kidneys are packed up. That was in May 1st, 2017. So he now took me out on that list, referred me to nephrology in Olu, Dr. Cole. And after 2 weeks, I had some blood transfusion, about 4 or 5 blood transfusions. And they now took the results again, the analysis. So there's nothing wrong with this man's kidney. There's nothing wrong with this man's kidney. Just to cut the whole thing short, I was treated for other minor ailments. Since March 1st, since May 1st, 2017, till now, I have not gone back to any dialysis center. I am healthy, I'm happy. I thank God I didn't sell my house again, because the people who wanted to buy it now understood what happened, and they took back the advance. Until tomorrow, I keep celebrating those 2 members of staff, Pastor James and Ogechi.
We have to run.
They gave their kidney for me, for little favors I did while being their director. Until date, I am alive. And nothing is happening to me. I'm healthy and happy, and everything about me is all right. So I would have died in a mission hospital. Some of these mission hospitals use retired old white nurses and doctors to run those places. And that is how I would have lost my house.
Thank you very much.
Lost my life, lost my car, lost my house, lost everything. I am still healthy and healthy. It's the message.
Thank you very much, Mr. Unduka, for sharing this story with us.
Can you have these 2 members of staff donating their kidneys at no cost? God bless them wherever
Thank you very much. We pray for
them.
Amen.
Amen. That's this diagnosis we have been talking about since morning.
Yeah. So I think we can end the show on that, because we have to wrap up. I think this is a good way to end the show. So not everybody is in like Mr. Unduka. Not everybody is like a Stanley who was able to survive. This is a man that would have sold his entire house, and 2 of his staff would have lost
the kidney of 2 staff members.
This is why I'm saying the regulatory body, because there are so many mushroom hospitals about. Like, you cannot tell me that anybody
so that man that made that diagnosis,
those
should take responsibility for his action. Unfortunately, we have to let our guests go. Thank you so much, Dr. Stella, for joining us. Unfortunately, we have to wrap up this time. But is there any final word you'd like to give us before you run off?
The question was important.
Okay. Well, as we mark World Kidney Day again in a few days' time, I would like to encourage everybody, please take care of your kidneys. And more importantly, do all you can to prevent kidney disease. And if you do have a serious kidney disease, or you've been told you have a kidney disease, make sure, do yourself a favor and see a nephrologist. See a nephrologist. It cost effective.
Right.
It may be expensive, but it will pay you at the end of the day.
Thank you very much,
And
madam. We
do yourself a favor, do basic life checks, health checks annually to detect and prevent kidney diseases.
Thank you very much, Dr. Alegbe. It's such a privilege having you on the show today. Thank you very much, Dr. Stella Alegbe, who's a nephrologist. Thank you very much for joining us. All right, we have to wrap up with the show, but I think we learned quite a bit about medical. We need to take a lot of tweets, too. Like, you have to run.
There are loads of tweets.
Please, can we hurry up and take it? Because we have to run. I only have a few seconds. Yes, go ahead, please, very quickly.
One needs to be careful. Dr. Dora Akuyili was diagnosed by a Nigerian doctor with cancer. However, another test was done abroad, and they said there was no cancer. In the end, the woman died of cancer. Human errors happen everywhere.
Tejiri says, I was diagnosed for ulcer in 2010 at the company clinic I was working at the time. Years later, 2 doctors confirmed I didn't have any ulcer.
Nigeria's health system is still based on the 1940s. Why can't colleges and schools of medicine use expert systems to help avoid misdiagnosis? That's from Andrew Streatham.
Ogumola says, try to get a second or third opinion on any diagnosis that scares or disturbs your emotions before commencing treatment.
Yeah.
Nigeria's healthcare system are poorly funded, and misdiagnosis may not be entirely based on the doctor's incompetence.
Okay, we have to. I think we can wrap up on that. So, in any situation, get a second opinion, see specialists to confirm before you begin treatment. I think that's one thing we've learned for today's show. That's all we can take. Enjoy the rest of the day. We'll see you tomorrow. Bye for now.